I need to get my omega-3. Marketing is fabulous. The omega-3, the plant sterol, the margarine, aromatherapy, antioxidants, the dental marketing, gum disease, they may play a little role. I mean, it's all with wellness, of course. Praying, meditating, I'm not saying that that's not good. You have to believe in something and you have to, but, fiber is excellent. Actually, it decreases your risk of colon cancer, but not the heart. Taking aspirin, primary prevention in women, we don't have proof. If your risk is not high, we don't have proof. So all of these, and hormone therapy, of course, it came and went. But one of the things, when you see less than 0.001, that's what doctors look for to say that's significant. It's a significant association. And there was, between 1997 and 2009, there was an increase, significant increase in the belief that multivitamins could save you from a heart attack. And then, of course, we found out that hormones, we couldn't figure out who was helped heart-wise and who was not, and we no longer recommend it for prevention of heart disease, although it's wonderful to treat symptoms, a small dose for a short period of time. But then, of course, the belief in the hormone to prevent heart disease, again, because the marketing was very good and people got that. So this acute coronary syndrome, we talked about it as much as I want to say, but so it's the acute event when there's plaque rupture. It's either heart attack or a heart attack in the making. It's an emergency. Pardon me. So what do we do to survive a heart attack? The most important thing is to call 911 within minutes. With our heart attack program, we found that elderly people were treated faster. When do you hear that? Were treated faster with a heart attack of the STEMI type that I talked about than younger people, because elderly people would call 911 rather than drive themselves to the hospital. People in their 40s, 50s would say, Joe, you don't look good. Let's go to the hospital. Drive to the hospital, wait in triage, wait in the waiting room. Calling 911, if it's not a heart attack, they don't charge you. Call 911. Emergency medical personnel will begin treatment at once, as we say, so you don't drive yourself to the hospital. And to not be certain is normal. People don't come with their diagnosis on their forehead. So, don't be embarrassed by a false alarm. Sometimes we say people have a heart attack and we say, so it started at 8 this morning, and what time is it now? 8:15. What, did you not think of coming to the hospital? Well, I did, but I thought it would go away. Well, I thought maybe, what if it's not? Well, if it's not a heart attack, again, don't charge you. You've wasted, hours of your life. Well, you might have saved your life too. Plan ahead and know the warning signs, like we said. But there are missed opportunities in diagnosing heart disease in women. With less classical symptoms, as we talked about, women often present later. And when they do present in triage, if you say, I don't feel good, why? I'm tired, So but if you do have discomfort in the chest, or if you know somebody who does, or any of these symptoms, or this instability of more discomfort more often, it wakes me up at night now, I can't do anything. I was able to walk, a city block last week, but now it happens when I walk 3 steps, all signs that it's unstable. But on the medical side, if our questionnaire, when a woman comes to the emergency room, is, do you have chest pain? And the pain I know is the delivery pain, I'm going to say no. And when I say no, they put me in the blue room. And when I say yes, they put me in the red room, and the alarms go off, and they come to the cath lab right away. So we're trying to train the doctors to not just ask about chest pain. But we also know that the incidence, that mean in a population, the chance of having a silent heart attack, you hear of that sometimes. I went to my doctor and they said, gee, on your ECG, it looks like you've had a heart attack. Were you in the hospital? No. I had a bad indigestion 2 months ago, but so it's 40% more likely in women. But there is good news. Heart disease can be prevented. In fact, 90% of those, that risk that we talked about, can be helped on, because we said genetics is 10%. So the treatment, of course, lifestyle change, I can't say it enough. Control of risk factors, if needed, medication. Oh, I don't want to go on medication for my diabetes. Why? I don't like medication. Did you ever hear that? Did you ever say that? Of course, of course. And diabetes is going to say, okay, then I'm not going to affect you. No, that doesn't work like that. High blood pressure, well, that's even worse. I mean, diabetes, at least it's when it's not well controlled, you know, you're thirsty, you know, often you have symptoms. High blood pressure, you don't feel. I don't feel like taking medication. Well, I think my blood pressure was probably high because I waited a long time in a doctor's office. Yeah? Or I couldn't find parking. You know, I was upset. Okay, let's take it, you know, next time we'll check. Well, you're again borderline, you know, Mrs. Smith. Well, yeah, I know, but I think this time, you know, my daughter just had a baby and, you know, it's been very busy. Okay, well, we'll see next time. And this drags on. Does that sound familiar? Right. So we get the history that I've had borderline blood pressure for 20 years, you know. And then when we look at the cardiogram, we see signs of chronic, long-standing heart disease that has been affected by the blood pressure. So if needed, medication. Lifestyle first, if needed, medication. And procedures to restore blood flow, to either open the plaque with balloon and stents. That's called a percutaneous, through the skin, cutaneous intervention, and I'll show you, or bypass surgery when restoring blood flow is needed and we don't have any dreno or anything of the sort. For women, again, because of efforts of people like you, we have guidelines, and we have better guidelines for prevention of heart disease than the population at large. I'll say that for the one man that's here. Oh, I'm sorry, I've seen you too, and I've looked at you in the eye too. I just can't count. So we have very good guidelines that are updated. So this is the original. No, this is the 2007 update. And all doctors should know that. Do all doctors know that? I don't know. 5-step approach. This is what your doctor is or should be thinking of. Aloha. So A for assess and stratify the risk. And I'll show you how quickly we can stratify. By stratify, we can categorize the risk of heart disease. Then lifestyle approaches for everybody. If you don't have heart disease, you can prevent it. If you do, you can improve it. Other cardiovascular disease interventions, treatment of blood pressure, diabetes, cholesterol. Of course, high priority for intervention when heart muscle is at risk, is jeopardized, person is at risk of heart attack or sudden death. And avoid initiating therapies that show no benefit. Don't spend your money on buying omega-3 vitamins. So what's a high-risk woman? In the top category, either with established coronary disease, so a diagnosis before. I have either angina, I've had a heart attack before, or I have other vascular disease. I have blockages in the arteries that leads to the head, the carotids. I have blockages in the arteries that lead to the legs, peripheral vascular disease. I have an aneurysm of the aorta, an enlargement of the aorta in the abdomen, or I have severe kidney disease, or I have diabetes. Again, just diabetes puts me at a high-risk category. So a diabetic woman, the medical world needs to pay attention because we need to put all efforts on reducing risk. So the risk of having an event, if you're in the high-risk category, is greater than 20% at 10 years. And that can be reduced by controlling those risk factors. At risk, at least one of those risk factors that we talked about. And at optimal risk, healthy lifestyle, then the risk at 10 years, it's never zero. The risk of something is never zero. Insurance companies will tell you that when they sell you insurance policies. But with a global, Framingham Global Risk is a tool that we have to calculate risk, to estimate risk. Less than 10%, so that's the normal. So class 1 recommendations, that means the recommendations that have the best evidence for prevention. For smoking cessation, of course, of tobacco and secondhand smoke, getting away from secondhand smoke, very important. It's a right to be in a smoke-free environment. And there's a petition going on smoke-free terraces. What am I trying to say? You know, those little, you used to be able to sit at the patio of a restaurant, and now it's mostly for smokers. So there's a petition going on. I don't know if DIVA can get involved with public health. That would be a great idea to sign those petitions so that outdoors remain or become smoke-free as well, at least in public spaces. Or behavioral changes work for smoking cessation, or sometimes you need a little bit of help of medication for a temporary period, and that works really well. If somebody has decided they want to quit, absolutely. Physical activity, what are the guidelines? Moderate physical activity, at least 30 minutes, 5 to 7 times a week. And for weight loss, of course, 60 to 90 minutes, 5 to 7 times a week, or for maintenance of weight loss. Healthy eating, of course, lots, what we all know. Fruits, vegetables, whole grains, fibers, lots of fibers, fish twice a week, limited saturated fats. Alcohol, no more than 1 drink a day for women, no more than 2 for men. If you don't drink, you don't start to protecting the heart. This business of, I'm going to get into this new habit of drinking only the best red wine to save my heart, it's not for your heart. It may do other good things for you, but not that. And salt less than 2 grams a day. Do you look at labels? Yes, you know how to read labels. That's a very important thing. And weight management, know what your BMI is. The next slide will address. And abdominal circumference. When you go see your doctor for the first time, if you're lucky enough to have a family doctor, they will not only take your height and weight, but generally they'll take your abdominal circumference. So you need to know, who knows their social insurance number by heart? Now what good is that, right? Like that serves absolutely no purpose. Who knows their blood pressure reading? Well, at least you've got that. You know your blood pressure. Who knows their cholesterol? Fewer. Who knows their blood sugar? That wouldn't be fair because you wouldn't actually know your blood sugar, but who has had a determination of blood sugar to know that they're not diabetic or pre-diabetic? So you've had, excellent, all right. But we need to know. You know, you go to the doctor and they take your blood pressure, and so your question is, how is it? And what's the answer oftentimes? Fine. What kind of number is that? Fine. Is that fine over fine?